Hi everybody, Justin Feldman, Feldman Physical Therapy and Performance. Got Renee here today, and we're going to be talking about blood flow restriction training and blood flow restriction therapy. So one of the things that we are starting to see more of is as blood flow restriction training, blood flow restriction therapy becomes more common, you're going to start seeing more and more of it out there. But I think it's really important that everybody realizes the right way to do it and that we really understand the science behind it and what we're trying to do. So what we're trying to do is we're trying to create some restriction in the limb. So we're not trying to occlude the limb. We're not cutting off blood flow altogether. And what we're trying to do is we're trying to create an environment that is metabolically way more stressful for the limb than it necessarily is load-wise. So this is something we're going to use with people who maybe can't handle a heavy load based on where they are in their rehab, maybe based on whatever they're training for, what their goals are. They don't want to work with a heavy load, but they still want to make the strength gains and even some hypertrophy gains through their training. So easy example is post-operative ACL, and they're not allowed to weight bear, and we can get them doing this, and we can maybe have them do some really boring leg raises and stuff like that, and they can get a much more stressful workout, prevent some muscle loss through that. Now, the thing is, we get this in, you want to make sure that each patient, each client is getting an individualized and a personalized occlusion pressure for them. So whatever it's going to take me to get to that 80% occlusion on Renee is going to be different than what it might take me if I was doing this on myself. So what we're going to do is we're going to use a doppler ultrasound so we know exactly what pressure Renee needs for her, and we're going to do it differently, right leg and left leg. And we work with patients, we do this, we're going to do it every single time they come in, because depending on what their blood pressure is and what's going on, their heart rate, that pressure might be different for that day. So it's a very specific thing. You want to make sure you're doing it every time. You'll see people out in the gym who maybe buy their own cuff on the internet or wrap their arms with elastic bands like Arnold did or something like that. And that there are some negative effects to that. There's some risks to nerve damage and different things that you can do. So it's really important from a safety perspective that it's an individualized pressure. So what we did is here for the magic of video or YouTube, we've got Renee's left leg all set up. So we're going to get her right leg all set up now. So we just a little bit of gel. Hopefully Renee's got some blood flow in her leg.
Probably not.
Find the artery here. Good. Go ahead and pump that up now. Almost, keep going. Good. What are you at there, Renee?
220.
220. All right. That's perfect. 80% of 220 is easy math. So we're going to cut you down. Don't worry, I won't make you do the math. Good. All right. So next thing is, nice thing about these nice new bands that they've come out with is we can disconnect the hose so Renee's not working out with the hose attached to her. So great. Now what we're going to get you to do, Renee, is we're looking for high repetition, low load with this. All right. So you want to be somewhere, way below 1 rep max, somewhere 20-40% is where we like to stick with most of our patients. So for this, we're just going to have Renee go body weight squats. So Renee, the rep scheme we're going to do is 30, 15, 15, 15. So what we're going to do is 30 squats, you get 30 seconds off, and you're going to the next set.
Okay.
Go ahead, 30. Good. Nice and slow. Good. So give everybody an idea kind of like what it feels like, Renee.
I feel like weak.
Okay. How's that different from normal? I'm just kidding. I'm calling you weak.
Probably.
Good. So we want to make sure she goes nice and slow. You'll see people try to speed up as they get tired. Now we also want to make sure she gets no tingling or numbness in her legs.
Nope.
Nope. Good. If she did, we cut it down, lower the pressure a little bit. We also want to make sure she can count to 30.
17.
All right. Good. So what we're going to do is she'll get 30 seconds off, and then we're going to go into 15, 30 seconds off, 15, 30 seconds off, 15. We'll kind of work through like that. We'd come up with a routine for Renee based on her goals that's somewhere around 20, 30 minutes. And we keep going with some nice global movements. So maybe after these squats, we would have Renee do some single leg deadlifts. We might have her do some lunges. Might have her do some regular deadlifts and give her some weight. But we'll be nice to you, Renee, and we'll let you stop there at the 30. So blood flow restriction training, a lot of benefits. You're going to see more and more of it as time goes on. And the biggest thing is making sure it's done right and done safely. So have a great week, everybody. We'll see you right back here. Thanks a lot, Renee.
You're welcome.